Good morning. Before I begin this morning, I want to respond to the Liberal and NDP conventions that took place this weekend. It's clear that the Liberals and the NDP are in a race to the left. Who can be the most extreme? On one hand, the Liberals want a massive and expensive new program to pay people not to work. On the other, the NDP made it clear that they care more about fashionable left-wing policies like bashing Israel and the military than they do about working Canadians. The choice becomes clearer and clearer. If you care about trendy causes and major experiments with our economy, there are two parties for you to choose from. If you care about jobs and getting Canada's economy back on track, you have only one party to choose from, the Conservative Party of Canada. Le choix devient plus clair si vous vous souciez des concepts à la mode ou si vous voulez réimaginer notre économie, vous avez le choix entre deux partis. Si les emplois sont importants pour vous et si vous voulez remettre l'économie canadienne sur les rails, il y a seulement un choix, les conservateurs. Canadians are having a very difficult time coping with the current spike in COVID-19 cases and the accompanying lockdowns across the country. Hospitalizations and ICU admissions are soaring in this third wave of the pandemic. Healthcare workers are exhausted, but they remain our steadfast guardians on the front lines. Many businesses are closed, and workers are losing their jobs or having their hours cut. The mental health crisis our communities have been struggling with across Canada has deepened, and Canadian families are worried about their children. This is what Justin Trudeau's vaccine failure looks like. It has real consequences for Canadians. Des entreprises fermées, des emplois perdus, des heures de travail réduites, une hausse rapide des cas dans les hôpitaux et des problèmes de santé mentale plus nombreux. Voilà à quoi ressemble l'échec de la vaccination de Justin Trudeau. In the United States, cases and hospitalizations are dropping. Businesses are reopening. Restaurant patios are busy, and fans are returning to watch in-person Major League sports. This is happening because more than 1/3 of the U.S. population is partially vaccinated, and 20% are fully vaccinated. Yet fewer than 2% of Canadians are fully vaccinated. In the words of one Canadian public health expert, the vaccine rollout has been, quote, too little, too late, end quote. And the provinces are forced to defend against the third wave of COVID-19 with inadequate vaccine supply. Les États-Unis ont déjà administré assez de doses pour vacciner la population canadienne au grand complet. Malheureusement, seulement 2% des Canadiens sont complètement vaccinés. Avec une telle gestion des libéraux, la situation actuelle était inévitable. C'est la troisième vague de Justin Trudeau. Today I will be meeting with the Prime Minister. Throughout this crisis, Conservatives have worked with the government to get Canadians the help they needed quickly. We would vote to approve support programs and work to fix the gaps in the programs afterwards. Conservatives have always put the health and economic needs of Canadians first. Mr. Trudeau has rejected many of our suggestions in the past, but I'm hopeful that he will be more willing to listen this time, especially given the seriousness of the situation we're currently in. The severity of the third wave for Canada is due to the Liberal government's failure on vaccine supply. You need only look at the situation in other countries to know that this is true. I can assure Canadians that while we are all heartbroken by more COVID deaths, exhausted by the case counts, and frustrated by the slow vaccine rollout, our resolve will see us through this. While we have been lagging the world on vaccines, we can become leaders again. We will learn from the lack of readiness and mistakes made in this crisis and ensure we are better prepared in the future. I firmly believe that Canada's best days are ahead of us, but our country requires serious and ethical leadership. As Parliament returns for 5 weeks ahead of the summer, Conservatives will demonstrate leadership and show that our Canada Recovery Plan can be the first step towards securing a brighter future for all Canadians. Thank you. Merci beaucoup.
And we'll now take questions, starting with questions on the phone. A quick reminder, as usual, one question, one follow-up. Nous allons maintenant prendre les questions, en commençant par les questions téléphone. Un petit rappel, une question suivie. Today, Mr. O'Toole will take 6 questions. Aujourd'hui, M. O'Toole prendra 6 questions. Operator, do we have the first question?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour toute question. La première question, the first question is from Raymond Filion, TVA. Please go ahead, your line is open. Votre ligne est ouverte.
Merci. Bonjour, M. O'Toole. J'aimerais savoir ce que vous pensez du projet de loi C-233 de votre députée, Mme Wagantall, qui propose d'interdire les avortements sexo-sélectifs.
Merci pour la question, Raymond. Comme vous le savez, je suis pro-choix et je vais voter contre ce projet de loi privé.
Mais au-delà de voter contre le projet de loi, est-ce que vous allez tenter de le bloquer d'une quelconque façon?
Comme Premier ministre, je vais toujours défendre les droits de tous les Canadiens et Canadiennes, incluant le droit pour les femmes de choisir pour elles-mêmes. C'est clair, c'est important pour moi comme Premier ministre et c'est pourquoi je vais voter contre ce projet de loi privé.
Opérateur, prochaine question.
Thank you. Merci. La prochaine question, the next question is from Rachel Gilmore, Global News. Please go ahead, your line is open. Votre ligne est ouverte.
Hi, Mr. O'Toole. I have a similar question to that of my colleagues. Cathay Wagantall has introduced a private member's bill that she describes as seeking to prohibit sex-selective abortion. Sexual rights experts say that it is virtually impossible to do that because no one can know what's inside another person's head when they make the decision to seek an abortion. Instead, the only option to actually achieve that is to make it harder to access abortion writ large. You've said in the past that you're pro-choice. You just said it again now. Will you tell your shadow cabinet to oppose this bill?
Thank you, Rachel. As I said in French, as you know, I'm pro-choice, and I will be voting against this private member's bill. I will always, as Prime Minister, defend the rights, the human rights of all Canadians, including women, to make this decision for themselves. I've been crystal clear on that and will be as Prime Minister.
But the one thing you're not being crystal clear on is whether you'll direct your cabinet, your shadow cabinet, when it comes to this vote. I'm wondering, do you not think that calling yourself pro-choice carries a responsibility to ensure nothing your party does strips the rights of others to make the choices that they decide are best for them?
Yes, being pro-choice means I will defend that right, and there will be no law passed that will restrict the rights of Canadians.
Operator, next question.
Thank you. Merci. La prochaine question, the next question is from Catherine Lévesque, La Presse canadienne. Please go ahead, your line is open. Votre ligne est ouverte.
Oui, bonjour, M. O'Toole. Je vais retenter de poser la question, mais en français. Est-ce que vous allez laisser votre cabinet voter pour ou contre ce projet de loi?
Comme vous le savez, Catherine, je vais toujours défendre les droits des Canadiens, incluant les droits pour les femmes. C'est mon bilan comme un député et ça serait mon approche comme Premier ministre. C'est important pour moi de défendre tous les droits humains des Canadiens.
Ne pensez-vous pas que vous devriez faire preuve de transparence au sujet de cette question alors que vous vous présentez comme un gouvernement en attente? Pensez-vous pas que les Canadiens devraient savoir où votre cabinet fantôme se loge là-dessus? Est-ce que ce sera un vote libre ou non?
C'est important pour moi de dire une chose clairement. Je vais toujours défendre les droits des Canadiens, incluant les droits pour les femmes de choisir pour elles-mêmes. C'est une garantie pour moi comme Premier ministre.
And now we'll take questions from the floor. Nous allons maintenant prendre les questions de la salle. Première question, first question. Teresa?
Hello, Teresa Wright from the Canadian Press. Just following up on the same issue, How do you expect Canadians to believe your party is inclusive and appeals to women when your party is putting forward bills like this one?
As I've said, I'm a pro-choice member of Parliament, was elected leader of the Conservatives in that fashion. I will always defend the rights of all Canadians and focus on their prosperity. That is my relentless focus. There is freedom of speech of all members of Parliament, including with private motions and bills.
Follow-up?
No, you go ahead.
Next question.
Oui, bonjour, Monsieur O'Toole, Laurence Martin de Radio-Canada. Monsieur O'Toole, est-ce que l'avortement est un dossier réglé au sein de votre parti?
Merci, Laurent. Ce n'est pas le cas, mais on a une liberté d'expression pour tous les Canadiens et Canadiennes, incluant les députés. Mais comme chef de l'opposition et comme Premier ministre, c'est important pour moi de défendre les droits pour tous les Canadiens et Canadiennes, incluant le droit pour les femmes de choisir pour elles-mêmes.
Excusez-moi, j'ai juste pas compris le début de votre réponse. Qu'est-ce que vous voulez dire par ce n'est pas le cas? Le dossier de l'avortement n'est pas réglé au sein de votre parti. C'est ça que vous voulez dire?
Ce n'est pas une priorité pour notre parti. Je vais être totalement ciblé sur le bien-être des Canadiens. Et comme j'ai dit, comme Premier ministre, je vais défendre les droits de tous les Canadiens. Je suis ici aujourd'hui de parler sur la troisième vague de la pandémie, sur le bien-être, la santé des Canadiens. Et je vais voter contre le projet de loi privé.
Est-ce que c'est un hasard que vous teniez un point de presse en ce moment, au même moment où votre député, justement, Cathay Wagantall, présente son projet de loi sur l'avortement?
C'est juste par chance, parce que je suis ici, parce que j'ai un appel aujourd'hui avec le Premier ministre et je vais parler sur la pandémie, la troisième vague, l'approvisionnement de vaccins insuffisant par son gouvernement et un plan pour une relance économique. Les Canadiens sont tannés après une année de la pandémie et c'est très frustrant pour les Canadiens d'être dans la 50e place dans les vaccins. Et c'est pourquoi je vais lutter pour une réponse plus efficace dans le futur.
Last question, David.
Hi, Mr. O'Toole, David Thurton, CBC News. Just looking forward to the budget, do you think it's necessary for the federal government to provide stimulus to the economy as we go into recovery mode?
Thanks for the question, David. We will see what the budget brings. I'm going to speak to the Prime Minister today about the need to get all Canadians back to work, not to have an Ottawa knows best. They choose which parts of the economy they're going to reimagine. I'm very concerned about the massive spending commitments made at the Liberal Convention. So we'll see what the Prime Minister has planned for the budget. It's been over 2 years. Canadians want clarity and transparency with respect to the public finances.
But in your discussion with the Prime Minister, are you going to make the case that there needs to be some stimulus? The Liberals have signaled in their fall economic statement that they're going to provide up to $100 billion over the next 3 years in stimulus to the economy. Are you going to make the case for a similar amount? Are you going to make the case that, you know, that the government doesn't need to step in? What's your position on providing stimulus?
Well, David, I'd like to provide help to the thousands of Canadian small businesses holding on by a thread to highly impacted sectors like tourism, like the airlines, like hospitality. We've been advocating for them for 6 months, and the government is leaving them hanging by a thread. Let's save those jobs and that economic activity before we have these grandiose reimagination exercises. I worry the stimulus is going to be done while they're letting people go insolvent in small businesses and people fall further and further behind in this pandemic economically. So we'll be fighting for those Canadians who haven't had a voice with Mr. Trudeau. On doit cibler sur la crise avec nos PME maintenant. Il y a des milliers de PME qui sont prêts de faire faillite à cause d'inaction du gouvernement Trudeau. Ce n'est pas le temps pour les grands projets de réimaginer notre économie. C'est le temps de sauver nos PME, les emplois à travers le pays.
And this is all the time we have. C'est tout le temps qu'on avait. Merci.
Thank you very much.
Thank you. Merci. The conference has now ended. Please disconnect your lines at this time. We thank you for participation.